be Glenn Liebman to come on down.
Thank you, Chairman Farrell. Good afternoon, and thank you very much for having me today. I'm very much grateful to the panel members for their friendship and support for people with developmental disabilities, their families, and their professional caregivers. The DD field is really in disarray, and public policy decisions are the driving force. Families are terrified, and the professionals in the field feel like we are drowning. It is a state obligation expressed in law to provide support for people with developmental disabilities. While I'm appreciative of the efforts of OPWDD that are expressed in the Commissioner's testimony today, you'll note that my tone is a little less optimistic. We are almost exclusively funded by Medicaid, as Mr. Searider mentioned before, and we're essentially operating as agents of the state. And therefore, we're almost entirely dependent on the state for the funding, and the state budget has really let us down. We have to ask ourselves, in a budget that invests tens of billions of dollars, how can human services be so ignored? Our employees start between $9.50 and $11.50 an hour, and the average pay is between $11.50 and $13.50 when they reach their pinnacle of their careers. Rather than repeat what's been said today, and you've had a great dialogue today, let me give you some numbers. NYSARC employs 28,500 people. 77% of them are direct support professionals or other lower wage workers that provide direct care, such as teacher aides in our preschools or the bus drivers that bring people to and from the programs. So we have about 22,000 DSPs. We already have a vacancy rate of about 8%. In other words, we can't fill all those jobs, so we're using thousands of hours of overtime. There's no more important job than taking care of other people. And it's plain and simple. An unfunded minimum wage will bankrupt NYSARC, and which is the state's largest provider of DD services, and it will also drive people out of the programs. I have a very simple formula for you. The minimum wage, if the pathway that has been proposed, already implemented for some sectors by through the wage board, could be done by legislation if it goes forward. The minimum wage is going to go up $1.75 in the coming fiscal year throughout the state, $3 in New York City. If you fast forward to 12/31/2017, not that far out, it's a 30% increase throughout the state, 45% in New York City. What does that mean for us in dollar sign? It means a 16% reduction in NYSARC's workforce. It means by 12/31/17, we'll have to reduce our workforce 4,600 people. Now, give or take a little bit, for every FTE we have, we're providing support for between 2 or 3 people. So you reduce an FTE, you've got choices. One choice is to take away people's choices. In other words, to diminish their quality of life. So we've been talking about today how we want people to be more integrated rather than isolated. Well, integrating people into community means giving them choice and the ability to go out and do things. Well, if we go in that out, if we have to reduce our staff, we have to say, well, either we're going to serve less people, and that means more people will have to go into the state-operated system, or the state will have to come up with some other way to serve them, or we're going to have to reduce the amount of service they have. So instead of having 4 staff working with 4 people or 8 people, we'll have 2 staff. So that means that more time sitting watching television, because we can't take you out to do what you want to do. We're moving in the exact opposite direction that we want to go. And so we really need to look at funding the minimum wage for the direct support professionals. It's $270 million in this budget for all the DD field. Mr. Searider and Mrs. Hardiman, and we're all working together on this, all the DD providers, and it's $1.7 billion in full implementation in 2021. We are certainly grateful for the residential discussion that happened today and the Commissioner talking about some new money that's in there, but it doesn't address the culture of no. So the Commissioner talked about the number of people that are waiting for services. Several of you on the panel have joined me with parents to meet with them together who finished their testimony sobbing, who come up and you have to give them a hug after the conversation because they tell you the desperate story of trying to find a placement for their child, who's now an adult child, before they pass or before they're no longer able. So there are 3 things. Number 1, the money, and you've talked a little bit about the money today. Number 2, new development. Right now, we're not doing new development. We're not willing to build a building. We're not willing to put anything in bricks and mortar. We're simply saying, Well, as people leave the system, new people will come in. So my version of dealing with the waiting list is that when nobody comes up to you, comes to visit your office and says they're desperate because they've been trying to find a place for 3 years, 5 years, 10 years, then we've dealt with the waiting list. Because today, 11,000 is unconscionable. So we need to deal with that, but there's also the culture. It's a culture of no. It's a culture of no because there's no place to place people. So we need to work at reforming the system, coming up with a new way of measuring what we talked about priority 1 here, we talked about priority 2 here. Essentially, for you to become priority 1, the world has got to be about to end for you and your family. That's not the way to plan for the future of people in our communities. So we need to do a better job. So I thank you for the chance to come and visit with you today. I ask you to read the written testimony, which contains much more about the discussion that was held today. And again, I'm extremely grateful to all of you for your support.
Thank you very much, Mr. Avenatti.
Just like to make one point with you, and I think I want to piggyback on what you were saying. We're talking now about providing residential placements, not necessarily the most appropriate residential placement, but a placement somewhere in a bed for somebody whose world's about to end. From the point of view of your agency and from the point of view of providing good services, aren't you better off planning and saying and then determining what age should this child go into a facility or a group home and have several years of the parents being involved, helping the kid adjust to a new life without parents, helping the kid get a job, helping the kid do what has to, so that he can live a life when the parents die.
You're absolutely right. That's what we all want to do. And we have to remember that in New York State, we're going to have to comply with the home and community-based settings rules that are being set by the federal government within a couple years. We still have people that live in 12-bed IRAs or 8-bed IRAs, and we're going to need to help them find smaller, more community-integrated homes that are maybe 3 or 4 people living together or supported apartments. There's not a penny to do that. And so we're talking about not only 11,000 people that at some point in time we're looking for residential opportunities, and we have to remember, those families have taken the burden for many, many years of supporting these people at home. So they've done their due diligence in not only supporting their loved one, but in lessening the burden on the state. And so the state needs to be there to assist them in the future.
There's just one other question. The numbers that I see here is they're talking about this year 152 people being moved from very high intensity service locations to moving into the community. Do you have any number that your agency would use as to what it would cost to provide appropriate services for one of those people? From what I'm seeing here, they're providing $21,000
right.
maximum.
Okay, well, I'll tell you a story. It's a public story that we've shared, and we've been asking for help from, and we've not been able to get help. Our chapter in Niagara County accepted 4 people from a state developmental center to come and establish a residence in the community. That chapter, in 18 months, after all the funding that they received, lost $1.1 million on just that home for those 4 people because the level of intensity and services that's needed. We've come and asked for help, but the system now is set up so it's based on the system where there is no way to come back and say the money wasn't enough. So that chapter is close to insolvency. I don't know that it's going to survive. And that's just one home, and we have 1,500 homes throughout New York State. One home, we've lost $1.1 million. That's on top of the rate that's paid to us.
So the plan that they're proposing just can't work.
We're talking about numbers in the $15 million might be invested here, and 15 might be invested there, and 120 million there. And with all due respect to the fiscal health of New York State, because I understand we're talking about big numbers, but we're talking about big numbers.
Thank you.
Thank you.
Okay.
Oh, wait, I'm sorry, Senator Savino had a question.
So you don't run away. Thank you. I just want on the first page of your testimony here, you sat here and listened to Commissioner Delaney's testimony, didn't you?
Yes.
And you heard us numerous members ask her the same question over and over. Did she have a sense of how much money this minimum wage increase could
Right.
potentially cost the providers?
Yes, I
We
can
heard her
tell you.
say over and over that they hadn't really done an analysis and they did not know. So you've done your own analysis,
Right.
fairly simple. You know how many employees you have, you know how much money it would cost you, and actually you have a pretty good graph in here
Right.
in case people want to read it. Did they ever at any point ask your agency what it would cost?
Yes, we've been meeting with the Department of Budget regularly. They have our numbers, $270 million.
Not to interrupt, but
Yeah.
prior to the announcement of the $15, or was it subsequent to it?
We've been working on this probably since April. Yes, certainly prior to the budget coming out, we were trying to make the case for it to be funded in the budget, so we worked out the numbers, $270 million in this budget, the $1.7 billion in the out year,
In the out years.
2021. And in our conversations with DOD, they have acknowledged that our numbers seem to be pretty realistic. They haven't been critical of our methodology, so I think we're in the same probably neighborhood as they are.
Were you at all surprised when the budget was put out in January and there was no acknowledgement in the budget for the increase in the minimum wage for the nonprofit sector?
We're extraordinarily disappointed, and I can say that the parents that make up the governance of my organization are downright angry.
It's incredibly diplomatic of you. It would seem to be somewhat frustrating if you had spent months having these discussions and analyzing and providing the data, and to see that it wasn't reflected in the budget itself. And I don't mean to put you on the spot, but we've been told from the beginning that they hadn't analyzed it, they hadn't thought about it. Well, obviously they have, and they've made a decision not to put it in there, so I'm not sure whether they want us to put it in, or they're assuming that your agencies are going to absorb this. But based on the information you've given us, and based on your written testimony here, and the fact that you said 28,500 employees, of which 77% of them are direct support professionals, who earn at most $11 an hour in the entry level, and I think you said 15?
Their average wage is roughly between 11 and a half and 13 and a half when you look at different parts of the state.
Right.
Obviously, downstate wages are a little higher.
And their highest point?
At their average. So some people might make 15, 16, but one of the things that's a factor for us is if we move our new employees up to, say 12 or 13 or 14, the people that have been with us for 6 or 7 or 8 years, they can't stay there. We have to keep that career ladder. They've gone back to school, they've gotten certifications, they've gotten education. So they're going to end up, if they can't end up at the entry level, we have to bump them a commensurate amount in the career ladder. So really, it's shifting that whole workforce down a continuum, not just the people on their first day.
What is the annual starting salary for a direct support professional?
Between $9.5 and $11.5 an hour.
Do you know what the annual amount is?
Oh.
If you don't, that's okay.
I might have done the numbers, but it's in about 20,000 or so.
And you said you have a high vacancy rate.
Yes.
When people leave, do they go to the public sector? Do they go to the state agency or the county agencies?
Any of our chapters that has is in the community where there's a state operated program.
It's okay.
Excuse me, Senator.
Don't joke.
Any of our chapters that's in the community where there's a state operated program is used to having our staff get training with us and then leave as soon as there's an opening, because the state operating programs all start at well above $15 an hour. My chapters cut out the newspaper ads and send me these that say that the state salaries are starting at 15, 16 an hour.
That is exactly the point I was trying to get to. Many years ago, the difference between the nonprofit sector and the public sector, the difference in salaries could be somewhere between $3,000 and $4,000 a year. That gap has grown considerably over the past 20 years, so it speaks to how we value human
Right.
services in our nonprofit world when we are requiring more and more of those services to be
Right.
done by the nonprofit world.
Right.
Thank you for your testimony.
Thank you. The COLA issue has come up in addition to no money for the minimum wage. The COLA works out to about 3 cents an hour. So multiply that out by a work year of about 2,000 hours, which is the number we use. You're talking about roughly $50-something before taxes. So what, $35? So you can take a family of 4 out for a fast food dinner, but you can't take them to the movies because you couldn't cover the price of the tickets today. And so it's tantamount to zero. Our direct support professionals did get 4% last year, but that was after a 6-year freeze. So if you take 4%, average it out over 8 years, we're losing ground even before we talk about it.
Thank you.
Thank you.
Mental Health Association